You were listening in to the interview with the Health Secretary. What did you make of what he had to say?
So in terms of the advice to the public, we would absolutely support everything he said in terms of encouraging everyone to stay at home, uh, especially given the really good weather that we're experiencing. So please do stay at home, help us in the NHS and protect us by staying at home and not exacerbating the spread of the virus. And that's the safest way of us getting through this crisis. But we are concerned, and I think hearing from the Health Secretary that he's trying to support NHS staff at a time when we're hearing that we still have issues with personal protective equipment, with testing of frontline staff, that's still a concern that's ongoing. And I don't think he's really addressed some of those concerns for frontline NHS staff in his comments today.
Can you just spell out what it is like on the front line? You've been surveying some of your members, I think. What is it that you found?
So yeah, unfortunately, it's been 2 weeks since the Health Secretary said that he's pledging to ensure that the right equipment gets to the right doctor, the right hospital, and the right GP practice. And we've seen that, sadly, that's still not happening. So doctors have been left with no choice but to take matters into their own hands. At the Doctors Association UK, we've been working with Nestle, and we created an app called nhsppe.com. So since Thursday, we've been surveying hundreds of doctors in over 150 hospitals. And they've told us 43% of doctors have said they've got absolutely no eye protection at all, with nearly 20% telling us that they have no eye protection for the most severe and most high-risk aerosol generating procedures. Doctors have said that they're having to reuse masks, that should be single-use only, and that sometimes they're talking to nurses and nurses are doing some of these high-risk procedures and trying to hold their breath because they're unsure and unaware of whether the mask they've been provided is going to offer them adequate protection. So this is really harrowing to hear some of these stories across the NHS.
It's pretty staggering to hear that, to be honest. Over 40% saying they don't have eye protection, people having to hold their breath because they're worried. The government says it's really trying to address the issue of protective equipment, that it's the supply that has been lacking. Is the situation improving?
So we have seen in certain centres that the supplies are getting to the front line, but we're hearing every day of more and more cases, particularly with general practitioners who simply just don't have the eye protection and basic equipment that they need. Now, some places are getting a delivery, but then may not get a further delivery for several weeks, and so they deplete their stock well in advance of the next delivery. And we've seen doctors resorting to accepting donations from local schools, for example, of using science goggles that children would normally be using in their labs, but repurposing those for use in their surgeries. So we've seen tremendous amounts of effort from the local community to try and get personal protective equipment to doctors in the absence of things coming from the Department of Health.
We've seen some really sad cases this week of nurses losing their lives after testing positive for COVID-19. In Italy, more than 50 medical workers have succumbed to the virus. How concerned are you about the safety of people working on the front line?
Absolutely. So alongside the safety of our patients, the safety of our workforce, our doctors and nurses on the front line is our paramount concern. Given the severe lack of personal protective equipment that's getting through, we're all very concerned about potentially losing more colleagues. It's sad to hear that we've already lost doctors and nurses in the line of duty, doing their very, very best for patients. And none of us wants to hear further stories of frontline staff losing their lives.
Matt Hancock was saying that they're keen to try and ramp up testing, particularly, of course, of NHS workers as well, to try and hit a target of 100,000 a day. Is that news that you welcome?
Absolutely. We've heard for the last few weeks that testing is going to be ramped up. So it would be welcome news to see that actually happening in practice. He spoke about 10,000 tests a day, and some of those already for NHS staff. But those have not come without problems as well. So we've heard from doctors who have been sent to a testing centre only to be turned away and told that their name doesn't appear on a list. And these are individuals who are isolating. They may not currently have symptoms, but they may have family members, for example, in the household that have symptoms. And so hearing that almost 15% of doctors, 3 times the number that the Health Secretary quotes, are currently off work, is a significant amount of the NHS workforce. And that's a worry going forwards, that we can't get these people tested quick enough and get them back to work.
Yeah, clearly a bit of a dispute about the number and the proportion of doctors and other staff off work, self-isolating. And just finally, you can see that the government's been trying to ramp up the capacity in the NHS, building new hospitals, trying to get more ventilators, for example. But those numbers of cases, the number of people going to hospital, keeps ticking up across the country. What's the situation like in the NHS at the minute? Is the health service coping?
So the health service is very resilient. We've had pressures, and we know that over the last few years, we've talked about winter pressures being almost all year round. So we've gone into this pandemic in a position of relative weakness. However, every single member of the NHS is on hand to give 110%, to do everything they can to ensure that we pull through this. And I'm sure that my colleagues around the country are doing absolutely everything they can. In terms of ventilators and beds, most hospitals have got surge and flex plans in place of how they're going to accommodate more patients. And we've seen the opening of the Nightingale Hospital, and plans for further similar Nightingale hospitals that will help with the pressure. So we're hopeful that these measures that are put in place are going to be sufficient, but obviously these things are being reviewed on a daily basis as the situation evolves.